So now I'm going to hand it over to Dr. Tesfaye, who's based in Ethiopia. She is going to be presenting on the Ethiopian response and preparedness for COVID-19. So I'll let you take it over, Dr. Tesfaye.
Okay. Hello, everyone. It's a pleasure to be with you today. Today, I'm going to be discussing what COVID in Ethiopia looks like specifically in my hospital. My name is Dr. Tigist. I'm an emergency and critical care physician at St. Peter's Specialized Hospital. I'm also the emergency and critical care director there. So to say a few things about the COVID preparedness in my country, specifically at St. Peter's Hospital, I'm going to start with the brief introduction, followed by the statistical data of COVID in Ethiopia, the total numbers, and then how we have a patient flow at my hospital, and then what we do in our isolation treatment units, some of the challenges, and then I'll summarize with the acknowledgement. So we all know that COVID was coming, and it was inevitable in Africa as well. But in Ethiopia, the first case of COVID was found on March 13. And starting from that time, there was a growing awareness of the pandemic in the country. So there was an establishment of the Emergency Operations Center in my hospital during that time, during the time of March. So what we basically did is we started, the hospital came up with the emergency preparedness plan by introducing the concept of pre-triaging, basically screening everybody that comes in the hospital, be it the patient or the staff, and defining access. Usually patients comes with their attendees and the like, but after the COVID pandemic was found, we started limiting access, one patient with one attending, so that the number of people in the hospital would decrease. So few statistics. Currently, we have confirmed cases around 731 in Ethiopia. Today, we have added additional 100 of them, 100 new cases. We have today we have also 1 day, that will make a total of 7 days. New recovered 10 cases, which will make a total recovery of 191. And then we have 631 cases in isolation unit. So as you can see on the chart, majority of the cases reside in the capital of Ethiopia, that is the Addis Ababa, but it's also disseminated all over the country. So the preparedness started, the whole preparedness needs to be disseminated throughout the country. So the Federal Ministry of Health, together with the regional hospitals, started testing everywhere. And then they also prepared the toll line, the free toll line, that's the 8335 or 952, where people can call anytime, 24 hours, if they have a case that they suspect, or if they know anybody that fulfills the case definition. Even though all the hospitals in the country it's mandatory to have isolation units, there are specific sites that has been selected. The Eka Kotabe, where we are currently treating all the COVID confirmed cases. St. Peter's Specialized Hospital, that's my hospital, where we treat the COVID suspects with comorbidity patients. We also have the MILLINIUM Hall, where we also see when the number exceeds, we can see COVID confirmed cases, as well as we have a place in St. Paul MILLINIUM Medical College. But these are just a few of the sites that are designated for the confirmed cases, but it's mandatory for all hospitals to have their isolation units, so that until the public health emergency experts come and take that patients to the specific designated sites, it's mandatory to keep them in the isolation sites. So overall patient flow, Most of the patients come from the airports or the borders. There are few refugees that are coming to the country, but all of them, especially those at the borders, they are subjected to 14 days mandatory quarantine, as well as those who cross the borders also are subjected to that quarantine, mandatory quarantine. But if any of those persons have a comorbidity conditions that are requiring to the hospital admission and treatment, those are the patients that we take in my hospital. If they don't have any comorbidity conditions, we will shift them to the mandatory isolation units that are assigned for the country. So even though we accept referral patients, we also have patients that are walking patients that come saying, I have fever, I have contact, I have cough. There are few patients that we actually get from isolation areas who develop fever after 3 days of isolation. There are refugees that we take from airports. So the patient flow, there are different type of patients that come from different designated areas. So for those patients that are coming from other hospitals or other institutions, the communication is through the EPHI, that's the Ethiopian Public Health Institute. After they communicated with us, we actually we use the AFM severity score to determine which patients needs to go to which designated area. So we triage them based upon the AFM severity score and then transfer them either to the wards or the ICU. So in the pre-triaging screening, as you can see in the slide, initially we used to give mixed treatment, that is both COVID as well as COVID suspects as well as other patients. But now we are seeing only COVID suspects, but we screen everybody. We give that's thermal screening for everybody. There are hand washing basins everywhere, locally made hand washing basins that anybody who walks into the facility must wash their hands either by water or by alcohol-based sanitizers. As you can see in picture 4, people do not overcrowd standing, so that we have allocated standing points for each patients that are getting in. So in the pre-triage, what we are seeing is we ask the history, as well as we screen for fever, more than 38.5, cough, travel history, or contact with traveler. If they fulfill any of one of them, we'll shift them to the COVID OPD. The COVID OPD, basically what they do is they give them a face mask and then take detailed history. When I say detailed history, it includes the general information, including the socio-demographic status, sign and symptom, where the point of entry, where they come from, and the clinical condition, including the signs and symptoms if they have it, underlying comorbidities like pregnancy, cardiovascular, diabetic, or malignancy, risk factors like if they have occupational risk factors, if they are healthcare workers, if they are students, or their jobs, if they have travel history. All these documents will be fulfilled along with the contact tracing, which includes people who have been in contact with them the past 48 hours, their phone number, as well as their region. And then we move them to the isolation unit. Previously, we used to we used to ask the EPHI or the Ethiopian Public Health Institute for testing, but currently our hospital is doing its own testing, at sample collecting, and then we send it centrally for the processing. So after that, once we do the testing, if the patient comes positive, we move them to the Eka Kotabe Hospital, which is the treating facility currently. If they are negative, we send them home with education about COVID, self-quarantine, and the like. So my hospital's COVID unit, the picture that you see in the corner used to be the first COVID unit at St. Peter, where it used to incorporate only just 24 beds, 6 ICU beds. But later on, we moved the whole hospital to the COVID treatment area. So the whole hospital became COVID treatment unit. So all the staff, we have a central donning area. This used to be the pediatrics emergency unit, and we changed it into a central donning area where each unit, being emergency, ICU, or medicals, inpatient management, all of them will have a central donning area, and then they would go through a specific checklist that they should adhere, and then according to the checklist, they will be moved into different units, the units that they are. On the first picture, the blue arrow that you see is the arrow that shows the entry sites of the staff, and there's a red one that shows the exit. So the picture 2 shows staff saluting for a picture. So we also have a doffing area. The doffing area basically also have a checklist what they should do. So each team will be we will have a team leader, and each of the team leaders will be responsible for checking either the donning list or the doffing list. So St. Peter Hospital, the capacity, the emergency unit can accommodate around 16 patients at a time. We have 2 ICU units. Currently, we have only the 10 ICU units are being functional, but we are working to make it 50 ICU units. We have also Ward A to F, having a total of around 216 beds. We also give labor and delivery as well, neonatal ICUs, as well as the emergency operating theater. So what we do in the emergency unit is, or in the isolation treatment unit, is we have a daily rounds with attending physicians. We have close follow-up with the patients. Even though most of the patients seem very stable, they deteriorate rapidly. So we have close follow-ups, basic investigations. Medication-wise, we only treat because the patients are there with us only for give or take 24 to 48 hours, because that's the amount of time it takes to get the results. So we usually give them supportive treatments depending upon the cases that the patient presents to our treatment center. So the results, it's usually 24 to 48 hours. Sometimes it goes to 72 hours, depending upon the load, because it's being done centrally. And the testing capacity has been increasing throughout. It used to be in 300, 400. Now we are testing up to around 4,500 tests per day. And regarding mental health, we all know that the impact that COVID has created, especially on the healthcare workers. So we have a psychosocial support wing as well in the hospital, so that the staff, as well as the clinical as well as the non-clinical staff, can talk to each other, can talk to a professional regarding their stress and anxiety. So the challenges, we know our lifestyle, like all of us, especially in Africa, we are meant for, like, we are social beings. So that's the majority things that we cannot stop. Like, even though we tell them to wear masks, even though we tell them to social distance, when it's holidays, it's always crowded. So that's one of the biggest challenges that we are facing. And regarding the COVID related, we are facing shortage of medication and supplies, shortage of PPEs. We have long turnover time for testing, and contact tracing is also one of the problems that we are facing, because we can only get the first degree contacts, and especially those patients that are that acquire the disease can be random people. So if, let's say, for example, if the positive COVID positive patient is going from one site to another, during his whole trip, he also transmits the disease to many people. So we can pick the patients that the COVID patient is intentionally going to, but in between, we cannot pick those patients. So that's a few of the challenges that we have. And lack of isolation facilities, like our country has have only limited amount of hospitals, limited amount of isolation facilities. And if we are continuously going in the pace that we are going, that's literally it's going higher and higher by the day, we're gonna face a big challenge in the isolation facility. Finally, I want to wrap up by giving acknowledgement to my hospital's management, clinical as well as non-clinical staff, to all emergency professionals in Ethiopia as well as all over the world, and everyone that's fighting this pandemic. And also, since yesterday was Emergency Day, I want to say Happy Emergency Day to you all. These are the staffs saying in Amharic, we are here for you, so stay home for us. Thank you. If you have questions and comments,
Sorry, I think I was on mute, but thank you so much for that presentation. That was really informative. And I think because you were so comprehensive, there aren't many questions coming through. What actions are being put in place to prepare for an increase in cases? What are the things that you guys are sort of learning about, thinking about now as the cases increase, whether it's slowly or quickly?
Okay, so we are seeing an increment in the cases on a daily basis. We used to see only 5 cases, 7 cases, 15 cases where we actually panicked. But even today, we are having 100 cases that are positive. So we are having an increment in the case number of load. So what we are doing is, for those, we are also incorporating every patient that has COVID to an isolation center. We don't, since it's a little bit tolerable, we're still taking them to an isolation unit. But once we reach to the level that the Western society has already been in, I think we would go to the treating only the severe cases only. But currently, what we are doing is we have isolation units in the different university sites, dormitories for the patients, and those who require medical attention, or those who have comorbidities, or those who are critical, can be transferred to the designated hospitals that it's already been implemented on.
Well, I think we're all hoping that continued supplies of PPE, medications, everything continue to flow through to Ethiopia. And thank you so much for updating us on what you all are doing. It seems like some really great work, and we're wishing you all the best. So,
thank you for having us.
Thanks. So yeah, I just wanted to say one final thank you, of course, to Dr. Tesfaye and Dr. DeFries for presenting. And as I said before, all of this is recorded, so we will be sharing this information, and we'll also be sharing the PowerPoint presentations for anyone that wants further information. So this is all that we have for our program today. Again, these happen every Thursday, so please tell your networks to tune in Thursday at 2 p.m. South African Standard Time. We have a bunch of great speakers and great topics that are being covered. And then again, if you can't attend or can't connect, we'll have those webinar recordings available for you guys. So thank you and have a great day, everyone.